Good evening. A question which commonly get asked is when to see a spinal surgeon when you have got back pain. Now, back pain is a very common condition. It affects vast majority of people at very different stage of their life, and not all of them needs to be seen by a spinal surgeon. Most of the back pain should be treated by exercises, weight management, and working on your core muscles. Sometimes you may need help and support from the physiotherapist to look into your muscles and give you some tailored support. Especially if you're an office worker and your job involves a lot of sitting, then again, it's quite important to look into your postures and activities. But there are some instances where you will benefit from seeing spinal specialists, such as spinal surgeon, and getting investigation with an MRI scan. Firstly, if you get back pain and the back pain goes down to your legs with symptoms like pins and needle, numbness, and occasionally weakness, then in those instances, you need to see a spinal surgeon and you will benefit from getting an MRI scan. Second instance is when you have a back pain, but in combination of back pain, you notice that your muscles are getting weak. At that point, I do think that it is important to see a spinal surgeon. Third instance, when you have got back pain, but this back pain is not exactly in the lower back, which is a common place to get the back pain. You start getting pain in the upper part of your spine, which we call as thoracic spine. And in a normal layman is where your ribs are. If you get your pain in those part of the spine, then that does need investigations. You also need to be investigated if you get back pain and that makes you wake up in the night, and especially if you wake up in the night with sweating and back pain. Those conditions may suggest that you may have an underlying infection of your spine, and that may need to be again investigated and assessed by a spinal surgeon. Lastly, you may have a history of cancer. And if you've got a history of cancer, I think those patients definitely need an investigation with an MRI scan to make sure that there is no cancer in the spine. Some people very, very rarely not only get back pain, but also get back pain, leg pain, and they start having problems with their bowels and bladder, which in layman term, people start having some vague symptoms with urination, which they describe either as hesitancy, sometimes they describe as frequency, sometimes they get unable to pass urine, and sometimes they go into retention. All of these conditions are spinal emergency. We call them as Cordite-Minor syndrome, and at that point, I think the best thing to do is to go to the accident emergency department. But as I said at the start of the video, vast majority of people have got muscular back pain, which can be managed without seeing a spinal surgeon. But if you need some help, there is a very good service in Colchester area where you can go online and refer yourself to the physiotherapist, which is provided by the NHS, and they can assess you and depending on your symptoms, escalate you to the spinal physiotherapist in the Northeast Essex community, who call as back and neck services. Any more information, you may contact the NHS website as well as speak to your doctor. Many thanks.